watching News 5, part of the Scripps News Group.
Welcome back. Have you ever gotten a medical bill and you're like, what the heck are these costs? You're certainly not alone.
But Ohio has a new law. All hospitals have to be transparent with their medical pricing, and the state's Department of Health has to enforce that law. News 5 investigator Jonathan Walsh has found that what that enforcement looks like so far. So, Jonathan, patients are contacting you, wondering about these bills.
Yeah, and trust us, we hear you. And guys, all of that is with Ohio's transparency law. There's confusion about what hospitals are following which standards, and we uncovered price transparency audits have not been across the board in Ohio each month. Did they ever tell you how much all this was going to cost?
No.
Tim Hardy from North Canton says he called ahead of time and talked to staff of Summa Health's Green Emergency Department about needing help with some stitches.
It was given nothing but the affirmative that, yeah, this was going to happen. We'll take care of it. We do it all the time, no problems.
But he says the doctor then told him he could not do anything for Tim. He then received a bill from Summa for $1,600 and another bill from the doctor's group.
The actual doctor, that was over $700.
So $2,300 bucks.
$2,300 for basically taking up space and having maybe 3 or 4 minutes of the doctor's time.
To say the least, Tim has been frustrated.
Any other good or service I buy, no matter how simple or complex, I have a very good understanding up front.
The Ohio Department of Health, or ODH, is responsible for enforcing the hospital price transparency law in 200-plus hospitals in the state, making sure, for example, health systems show prices for services in dollars and cents.
We can stabilize the cost of health care and hopefully someday drive it down because the transparency and the price is out there.
Ohio Representatives Tim Barhorst and Ron Ferguson are the architects of the law that went into effect last year. ODH's first enforcement list showed half a dozen medical facilities not in compliance. This month shows just one hospital in the state not complying. Is Representative Ferguson a bit skeptical about that?
People at the Ohio Department of Health probably aren't going to be as strict as consumers, actual Ohioans, would be.
News 5 investigators were persistent with questions to ODH, which then admitted it does not audit every hospital each month. It just puts out a list as required. But since 2021, the feds have been leading the crackdowns on hospitals, including most recently involving hundreds of facilities.
This is the largest enforcement action we've seen to date by far.
Ilaria Santangelo is the director of research for PatientRightsAdvocate.org that's been tracking high rates of noncompliance from hospitals across the country for years now.
96% of Americans want price transparency. So the more monitoring, the more enforcement from Ohio or from the federal government, this is great for all American patients.
But there is a big difference at the heart of that enforcement. News 5 investigators combed through pages and pages of federal data and found CMS cited 19 different Ohio hospitals since January, while the most that ODH cited this year was 5, with each monthly list having the same hospitals, except one facility would basically come off the list every month, all showing the feds keeping its pulse on price transparency more. The American Hospital Association said this month improving price transparency is not working, calling the requirements on hospitals a significant administrative burden, and the complexity of health plans is much of the challenge to giving patients true prices. Meanwhile,
but in this case, it's just really sticking in my craw.
Tim tells us he got the doctor's $700 bill dropped. Summa apologized to Tim, cut its $1,600 bill in half, and said in part Tim was billed accordingly. Tim tells us more transparent details should be given to patients on their way out of appointments and procedures.
All the materials that were used, all the processes, tests, so you had an idea what you could expect coming in the mail.
The Ohio representatives tell us more enforcement and compliance are good, but they still want to add consumer protections for you so you can hold hospitals more accountable. They're going to take a look at that the next legislative session. ODH, CMS, Summa would not go on camera and answer our questions. You can read their full statements on our News 5 app.